Welcome to Life, bringing you insight and experiences into love, relationships, and fertility with a focus on enjoying life and moving forward. On today's podcast, we'll be speaking about Pulse Diagnostic with Dr. Miriam Pineles and Adrian Tercani, practitioners of acupuncture. They'll tell us about this ancient tool used to uncover the root cause of a condition. Love, insight, fertility, and experiences. That's what we talk about here. And I'm very happy to have two people joining us today, Dr. Miriam Pineles and Adrian, say your last name because I'm going to say it wrong. Tercani. And Adrian is a sports therapist and an acupuncturist, which is a fabulous combination. So I'm so glad that the two of you are here today.
Thank you, Lori.
Thanks, Lori.
It's good to be here.
Yeah, and the last time Miriam and I had the opportunity to talk together was when we did the radio show a couple months back.
Yeah.
And the two of us discussed fertility because I feel fortunate enough to be able to share so many patients with you. So one of the things that we're going to talk about today was, or actually the major topic was going to be pulse diagnostic. And I think when people think about pulse diagnostic or going to people for pulse therapy, they think of magnetic treatment. But I wanted to explain a little bit about what it was from my perspective, and then let the two of you really give everybody the specific information. So
Sure.
I had the fortunate experience of going to the office one day, and my patient did also, actually one of them. And what happens is you sit down, and each one of them takes one of your wrists, and they feel your pulse. And the sheer sense of being touched just makes you feel so cared for and loved, which is actually what my patient and I were talking about. And they feel your pulse, and through feeling your pulse, they're able to understand what it is that's going on in your body and to diagnose conditions that are difficult to diagnose. What's interesting about that is the insight that they get just from the touch really helps them to understand how to move forward and how to allow you to move forward. So through this treatment, we're able to uncover many things that are difficult to uncover. And usually people go to acupuncture or some type of other type of alternative medicine when traditional medicine hasn't worked. And it would be so nice for people to become aware of why maybe they could go to you first or second to avoid a lot of the other testing and things that go on.
Mm-hmm.
So, it'd be great for you to share that. When we think about fertility, which of course is something that I focus on, a third of the people don't have a cause to the diagnosis. And I know a lot of them seek your help, and I know that they get a lot of successful outcomes. But when we think about other conditions, like cardiac conditions, when we look at the people with the invisible handicaps like hearing or sight, or maybe a neurological deficit, a lot of those are vertigo. A lot of these conditions also, they don't know the cause. So I'm not sure where you want to begin, but maybe a little overview of what this actually is and how people benefit from it.
Well, a pulse diagnosis, it's probably 2,500 years old. It started a long time ago, and we don't really get taught that much in school about it and how to do it. It's sort of deemed something that's really difficult and inaccessible to us as practitioners. It takes a long time for you to be able to practice it efficiently. Miriam and I were fortunate enough to meet our mentor, who put it in a very simple and clear manner, and its accuracy and its ability to see what's going on in the inner workings of the body it's incredible. It's fantastic, and it gives us a real insight onto what's the mechanism of action to things that are going wrong in the body.
So that's pretty amazing that you do that just from touch.
Yeah, it is.
Yes.
Yeah, it's incredible.
And how do you do that? I mean, I know that when I was there, and I know when people who I work with go there, you feel the wrists and you feel their pulse. So how are you able, through touching somebody's pulse, to identify what so many doctors aren't able to through all this testing and medications?
Yeah. We're palpating specific regions on the wrist. So we're feeling at least between 4 and 6 positions on the wrist. These different positions represent different organs and body systems, the reproductive system, the circulatory system, the endocrine system. And we're feeling certain qualities, certain levels shapes. All these different things give us information about the picture inside and what is causing a particular symptom or syndrome. Based on what we feel, we then write a custom prescription, herbal prescription for the patient, and we'll also usually tailor our acupuncture treatment based on what we're feeling on the pulse. As treatment continues, these sensations that we're feeling will shift, and that's how we know that our prescriptions are working. Until within maybe 2 months, 6 months, 8 months time, a person's pulse has transformed into a balanced, healthy pulse, and we know treatment has concluded.
Now, do the people feel their pulse change, or do they know that there's a problem with their pulse? I know that sounds like such a, maybe crazy or silly question, but...
No, that's they see a change in the symptoms, the improvement of symptoms. Mm-hmm. So for us, it was really important what Miriam said there, is because we have a direct guide onto whether or not our treatment is successful. So unlike just trying and seeing if it's effective, we can tell that we're normalizing someone's system, and we know that we're on the right track. And they, pretty quickly, sometimes within a week, start to see improvements in their symptoms.
Wow, that's pretty amazing in a week.
Yes.
Yeah. Things like insomnia, they'll be sleeping much better within the first week.
Mm-hmm.
And we may be treating something like the physical heart itself, but one of the symptoms is insomnia. And so we'll get a good indication straight away because their sleep improves. So that's one example of how we can track our progress.
Are there any statistics or any information that's been studied at this point in terms of outcome? I know this has been around for longer than most medicine.
I would say no. On pulse diagnosis,
Mm-hmm.
I would say no. I think it's soon to come,
Mm-hmm.
but not right now.
As I said, it was mostly a lost art, and it's slowly gaining momentum now. But we don't. One of our mentors, Robert Doan, he is starting to do some research. In particular, he's found that through testing fluid dynamics that we can see that there is a different quality in all three positions. So we know that so far in our research that's actually true. What we don't know yet is how we can figure out each position is a different part or different organ in the body. So further research does need to be done to support. Our research comes from treating 100 plus people a week and seeing them improve and seeing the pulse come back to what we call a home position. A home position is a balanced position.
And I know balance is such an important piece in life. So what is the origin really of how? Do you know the origin of how this started when you went to the? I know the two of you were away. I'm not sure what country you went to or where you were when you took this course.
The method that we actually use originates from Dr. Jimmy Chang. So he's a Taiwanese doctor.
Right, that's right.
Yeah, who spent every day in a hospital in Taiwan, and he actually brilliantly he created this himself through trial and error, really. He would see very sick people, kidney failure, and he would tie a pulse quality with their situation. And through years and years and years, he was able to document, and actually he draws the pulse pictures. He's an artist. And put this all out in a book for us to benefit from and learn from. Yeah, it's quite brilliant.
Yeah, I think it's fabulous. It's just, as somebody who is going to try and play devil's advocate for a minute, how do you tell the world that this is a better way to go than going to your doctor and going through testing and, waiting until kind of the last resort versus put it up in the first 3 when seeking treatment?
So with our patients, we never negate the use or effectiveness of Western medicine. So it's something we respect, and like everything, Western medicine has its place, Eastern medicine has its place.
Right.
So,
and it's the complement of the two.
Yes.
Totally.
And so a lot of our patients already come in with that Western medicine assessment, labs, scans, and those are useful to us. And we use them in our treatment planning. And so it doesn't always have to be that pulse diagnosis comes before the Western diagnostic methods.
Okay.
But they should be used together, because what we can pick up on a pulse is the origin, the root of the disease.
Which is essential. That's kind of what we were talking about.
And you're right. And not only that, but how to best treat this person's manifestation of this disease. Because no two people are alike. And often the manifestation of disease isn't always the same. And so two people can come in with high blood pressure, and they'll get a diagnosis of high blood pressure from their doctor and perhaps be put on the same medication or maybe the same diet plan. But if they come in and have their pulse read, there's a good chance the root of their blood pressure, well, oftentimes it is different.
I so agree with what you're saying. I mean, in my practice alone, I could have 5 people that I'm working with who are depressed, and each one have a different reason for the depression.
Right.
And that's a little easier sometimes, I think, for people to understand because they're so familiar with it. But what you're saying is essential, and we really have to treat everybody as if they're a unique individual.
Yes.
Even to the point for us of cardiology, someone comes in for, as Miriam said, but it could be anything. It could be, as Miriam said, high blood pressure, but we might find it's from the liver in our system and not the heart directly, and we'll treat the liver and see changes. So it really is person dependent. It's very specific to each individual.
Or even the kidneys, right?
Right. And you think about it, that's true, right? Because everyone has a predisposition or everyone has a behaviour. It's very different. I might tend towards anger and someone else tends towards depression, and they will manifest and change the way our organs function and cause that same symptom. But the reason for the symptom is different in each person.
Right. I mean, that makes so much sense. It really does, because when you look at anything in life, and I think those are the people that fall through the cracks. It's the people that, they don't fall into like the bell curve.
Mm-hmm.
It's those outliers where the doctors get a little stuck. And those are the people who suffer because they don't know what to do, so they're walking around in chronic pain, whether it's visible or not.
That's right, Laurie. That's where we shine, actually. Is where they struggle to find the reason. We find that Chinese medicine acupuncture seems to excel, actually.
So how many people would come into your office? I mean, I could guess, to be honest with you, but how many people would come into your office and come to you and say, I have tried everything, and I don't know. Why are you laughing already?
Yeah, all of them, right?
Right. I mean, really, almost all of them.
Right.
They tried every diet, certain medications, certain other therapies.
And as you said earlier, actually, we'd like to change that because Chinese medicine is a great preventative medicine as well. And using the pulse, we can determine how your organs are, how the state of blood flow is, and we can not predict, but we can help to normalise, as we said, balance before the symptoms arise.
Right. So, balance is really important, and we were touching on that before. The thing about balance is that I think, sometimes, especially living in Manhattan, anywhere actually, but especially in Manhattan, everybody is rushing around so much that they almost forget that they're not feeling balanced. They actually get so caught up in the rushing. Mm-hmm. And it's important, my favorite expression, I mean, I think you know it well, Miriam, but it's just pause and perspective. Yeah. Give yourself that moment to sit back, take a deep breath, and say, wait a minute, what is really going on here? And so I sense that most people don't realize it until the opportunity comes up to say, wait, let's just slow down and see what's going on.
They don't realize it till a symptom comes up, unfortunately. They come in with anxiety or insomnia or IBS. Mm-hmm. And another beautiful thing about Chinese medicine, and one of the reasons I actually became a practitioner, is because of that first visit with an acupuncturist. Mm-hmm. Because, this person you're describing has now developed a symptom or a difficult challenge, and you come in for your first visit with an acupuncturist, and it's usually a 2-hour visit where someone listens to you and really listens to everything that you're experiencing, that you have experienced in the past that could be contributing to this present condition.
And how cathartic is that? Quite frankly, I see that with work, it's so cathartic.
It's
undivided attention, and then to have somebody holding your hand in your pulse at the same time is so supportive and loving and caring.
It's wonderful. Yeah. Right. And how often do you get that kind of time with a medical practitioner? So
almost never.
No,
yeah,
never.
Almost never. It depends, but it's rare. So what, we kind of talked about the gamut of all different kinds of conditions that are treated, but which ones do you really find are the most helped with your practice?
There's quite a few, but I mean, of course, like you, we specialise in fertility. And I think what's fascinating is what we can find without being told in the pulse through fertility. We can feel if the blood is flowing properly. We can often feel, believe it or not, cysts, fibroids within the pulse.
Really?
Yeah.
Yes.
That's
absolutely.
amazing.
I mean, we can even feel a history of abortion.
Yeah.
Seriously.
Yeah. C-section scars.
Yeah.
Now, how do
your
you
life
do
is in your
that?
pulse.
Because I know I can't possibly be the only person saying, how can you do that just through feeling a pulse?
We could probably, we could get theoretical as to why we think, but for me, it's the pulse it's a window into the inside workings of your body. It's like the headwater. You have your main artery running through there, your radial artery, and I like to see the body as a river system, and this is just giving us a small picture of what's going on in the whole system. And so if there's a block in the road, so to speak, we can feel that. And I think it's particularly visible in the reproductive organs, because I guess it's also in the heart too, because it's like a piping system. Everything has to be working properly.
Yes, yes.
And we can really feel whether that's not enough blood, too much blood, or if there's actually something physically blocking, like a fibroid, cyst or scar.
That's remarkable. It really is. It's remarkable.
Yeah, it is. It is.
Yeah.
And we are blown away every day, aren't we, Miriam? To ourselves,
Yes,
we stare at each other, and it's wow.
Constantly.
Mm.
And to add to that, there are certain qualities in the pulse that will indicate whether a person will have some trouble getting pregnant and whether there will be obstacles during an IVF cycle. And we treat accordingly.
Shout out to Miriam. She's very good at just through feeling the pulse. You can tell if someone how emotionally stable they'll be after birth, which is, as we know, incredibly important. If someone
That's
can
incredibly important.
offer something.
Yeah.
Yeah. I mean, I
Yeah.
work with people with postpartum, and it's devastating to them. So if, in fact, you're able to identify that there's going to be potential postpartum prior to delivery, what is it that you do? How do you prepare?
So when I'm treating pregnant women, I'll always feel their pulse. And if I do pick up a quality that shows me they have a tendency toward depression or anxiety, because those are different qualities.
Yes, they're very different.
And they show up differently on the pulse too.
But they do go hand in hand.
Yes.
But they are very different.
Yes. And so if we sense that I have a conversation with them about postpartum depression, what might show up for them, and I give them resources, and I let them know that there are herbs we use that fit their pulse quality that will help to soften the transition. After they have their baby and hormones come back into balance, there are Chinese herbs that help to boost their energy, and will also balance, will help the emotions become a little more smooth, less rocky. This can happen.
Yeah, I think it's essential. I really do. And the more that I work with postpartum, the more that I see that support is needed.
Yeah. And Lori, I'll tell you, so women take the information. There are some women who have history of anxiety and depression.
Right.
And for those women, I will actually send them home with the herbs even before they've had the baby, before postpartum has even developed, because I just feel very certain they're going to need it. And they always do. And they take it. But the women who are not sure if it'll show up, they'll usually call me within 5 weeks and say, hey, Miriam, I love my baby. Everything's great, but I'm crying a lot. I'm really tired, and I think I need some help.
Right. And you seem much more extreme with that as well with postpartum. I know I do.
Yeah.
So do you refer them for counseling also, or for support? I know there's not too many support groups for postpartum because the women are busy with their babies, but I actually am thinking of starting one because it's a time when people could use the support and understand that this is an imbalance. It may be a little bit of a premorbid leaning that they have with anxiety and depression, but it's a chemical imbalance at this point after the baby, and you need something to help you get over this hump.
And that's incredible that you might consider offering that, because it's true. It can be very severe, and
Yes.
It's something that definitely needs support and help, and we recommend often to you, Laurie, and others, but yeah, we always do. It's not just what we,
Yeah.
it's not just
Yeah.
herbs or acupuncture.
And
There's certainly
yeah, and not
support
to
group.
belabor the postpartum, but I would like everybody to know that there is help there, and lots of times you have incredibly loving support systems there, and you don't feel it.
Yeah.
And
Right.
you're not feeling it, not because they're not there. You're not feeling it because of your hormones at that point, and that all of your old coping mechanisms can't fight the hormones. And so what we
Right.
want to do is we want to try and find balance, to keep using that word today, but that's really what we want to do. We want to find balance so that you can continue to move forward and get back to where you want to be.
Yes. And I want to say for anyone listening, that sometimes, we know with patients that the herbs are not enough, and they're not the only thing that need to be given. And so there are patients that will take the herbs and notice it's not enough
Right.
and move on to psychiatric medication. Oftentimes they can take the herbs along with them for the
Right.
continued support, but that,
Yeah, and there's some very good psychiatrists that are able to work with this condition.
Mhm.
So it's incredibly treatable. Nobody is really alone, but you feel incredibly isolated and alone when you're going through this. And why wouldn't you? Just like fertility. And honestly, just like any hidden condition or any hard to diagnose condition where you just feel like you're out there and everybody has turned their back on you, except the two of you. So they can go to both of you and feel the love that comes out of this office.
Thank you.
So is there anything that you really want to share with everybody that you find that would be helpful, that would help them to understand that this isn't just feeling somebody's wrist, and that there's honestly help out there with, I don't know which conditions you want to talk about besides fertility?
I just like to use a case example because I think it shows the strength. This was very early on, actually, and I was fortunate enough for Miriam to let me practice the pulse. And I was feeling a patient's pulse, and I could feel these two significant lumps in this person's radial artery. And I had no idea what I was feeling, but I said, "Oh, do you have something around your chest? Is there something?" And I didn't know what I was feeling. I just could feel these two lumps near the abdomen chest area. And it turned out that she had 2 surgical implants that remained there. And I could clearly
my
feel them.
goodness.
I didn't even know I was actually a novice, and I didn't know really what I was doing. I was just learning. And that was the first moment for me where I went, I can actually feel physically what's going on in the body on the pulse. It's not an analogy. It's not something that I need to, paint a picture of. It's very clear.
That's amazing. Do you need to be a certain type of person to do this treatment or to do this diagnostic procedure?
I think you do it. I think maybe you do it in our field. Maybe the pulse itself. I think it's quite accessible. I'd like to believe we could all learn because it's so powerful and can help so many. That I don't know if Miriam thinks the same, but yeah, for me, I think it's pretty learnable.
Absolutely. You have to be hardworking.
You do have to be. Yeah.
You have to really work at it.
You
practice.
have to study hard. Yeah, that's for sure.
So are there any other masters in this besides your teacher? You've spoken so highly about this professor.
We have two teachers. So Robert Doan and Dr. Jimmy Chang. They're our 2 mentors, and we're starting to get a few people specific, especially through the United States, that are learning this and starting to practice. But once you learn and you get it right a few times, it's hard to deny. You just keep going.
Right, but it seems to me like the two of you are really expert in the field, at least in New York.
We have a lot of experience.
Yeah.
We're 3 years and we average 100 patients a week. So I'd say that we're quite experienced, yeah.
And are people calling you specifically for a post-diagnostic?
Starting to happen. A little bit.
Words, yeah. As word gets out, they're coming in for help, and they're learning about pulse diagnosis through their own treatment.
Yeah. So we don't specifically market that as much as, but people do hear about it, and then, we get that.
Well, thank you so much for being here today. I think that this is incredible. It's an incredible a diagnostic. I'm calling it a treatment because, and the reason why I keep going to the word treatment is just because when you're sitting there, and having somebody hold your hand and listen to you, it just feels like a treatment with that alone.
Mm-hmm.
So that's why I keep replacing it with the word treatment. But
yeah, thank you so much for having us, Lori,
Thank
and
you,
giving
Lori.
us a platform to discuss this beautiful medicine and this very sophisticated form of diagnosis. We love what we do. It's exciting for us every day, and the joy of helping people is incredible.
so if
thank
people
you.
want to contact you, how would they do that?
They can visit the website, www.conscioushealthandwellness.com, and there you can find our phone number and email address. And we're also on Facebook and Google.
Okay, great. Well, thank you so much. And thank you, everybody, for joining us today. If you have any questions or if there's anything I could help you with, please feel free to contact me at lorimetz.net.